Hello, welcome back. This is Mickey Peters and the Upside of Authentic Leadership. And I am really grateful and excited to have Dr. Charlene Flash, the president and CEO of Avenue 360 Health and Wellness. She's a member of my Vistage group and a very valuable member of the group. So I'm going to ask Dr. Flash a few questions and let you get to know her and her agency and how Vistage has helped her. So welcome, Dr. Flash.
Thank you. It's a pleasure to be here.
Fantastic. Well, the first question I have for you is to tell us a little bit about yourself and your journey to becoming the president and CEO of Avenue 360.
Oh, great. Well, my name is Dr. Charlene Flash, and I am an infectious disease physician. My story actually begins on the East Coast. I'm a first-generation American. My family's from Jamaica, and I was the first person in my family born in the United States. And as a young girl, I was crazy enough to have a dream that I wanted to end the HIV epidemic. And I'm one of those people who is so privileged to say that they've been able to live into the dream of their little girl self. Because as my career has unfolded, I've been able to do the kind of work that I envisioned in different ways than that young girl imagined so many years ago. But as I went along my trajectory, I was trained in adult medicine and pediatrics. I'm board certified in adult infectious disease, and I care for people living with HIV. Beside from that, I also do research in HIV prevention. So
Mm.
I'm simultaneously caring for folks and putting myself out of business on the other side as I do work to advance ways of preventing people from becoming infected with HIV. So as I was going through my career trajectory, and much of it was on the East Coast, I looked up and thought, if I want to make positive change in this domain, I need to go where the challenges are. And so in 2012, I moved to Texas because at that time, and still, Texas had the dubious honor of being the state with the most uninsured and the highest rate of uninsured individuals in the country, and had a very high rate of new HIV infections as well. And so as my career in medicine and in public health unfolded, I realized that I had developed a passion for bringing high quality healthcare to people who are on the margins, and that the lessons I'd learned from caring for people living with HIV, recognizing that you had to address stigma and housing and getting a job and financial security in order for people to be able to partner in their healthcare, that those lessons actually translated to other disease processes. And that's really what all of us want. When we think about full health, it's not just about whether or not you have a diagnosis or not. It's about mental, physical, and social well-being. And so I moved my family to Texas in 2012. I joined the faculty at Baylor College of Medicine and was doing research on HIV prevention, and started the first HIV prevention program to prescribe outside of a clinical trial or a demonstration project to high-risk individuals across the walk of life, regardless of their income. So both rich and poor. I was having a great time doing that work, doing my research, caring for patients, some collaboration with the health department, when an opportunity came up for me to become a part of the leadership team at a federally qualified health center. Now, federally qualified health centers are safety net organizations that provide care for people regardless of their ability to pay, based on their household size and their income. And as I started working in this FQHC realm, I was recruited over to become the CEO of Avenue 360 Health and Wellness. Now, Avenue 360 is a particularly unique federally qualified health center because aside from just providing high quality cradle to grave care for individuals regardless of their ability to pay, it also strives to address the social drivers of health. So as such, it's one of the largest providers of permanent supportive housing in all of Harris County. We recognize that, I have the dubious honor of leading a healthcare organization and joining in January of 2020 and being hit with the COVID pandemic a few months later. I often will tell people that my first year at Avenue 360 was the final exam of my career in ways, because I drew upon my medical degree, my infectious disease training, my public health training, administration, everything I needed or had experienced in life was had prepared me for the moment to help this amazing organization navigate through an international pandemic. But as I think about Avenue 360 and our response to the needs of the community, one of the things that emerged during that time was that with COVID, we all experienced isolation. We all experienced increased anxiety and stress, and many people sought solace in substance use, whether alcohol, whether drugs, whatever it is. Lots of people found that as their place of solace. And so we decided as an organization that we wanted to create a recovery-oriented system of care, that in a non-stigmatizing way, we would screen people for substance use challenges and engage them either with a peer recovery coach or with a licensed clinical dependency counselor or with a clinician to provide medication to help them with their challenges. At whatever space they were ready to engage, we wanted to partner with them as we recognized the burgeoning numbers of people with this challenge in this post-COVID world. That's just one example of the ways that we really try to respond to the needs of the community. And Avenue 360 is a 7-site health system. We have 6 outpatient locations that provide primary care services, pediatrics, adult medicine, OBGYN services, and women's health, as well as our GEM, which is our AIDS hospice, which provides compassionate end-of-life care for people who have been living with HIV who are now in their final days. We also provide primary care to people living with HIV, as well as dental services and mental health services, including substance use recovery support, psychiatry, and therapy. So we have a lot going on in the agency as we strive to serve the needs of the communities in which our various clinical edifices are. We try to be responsive within those communities, and we have various wraparound services that will help individuals and community members be able to partner, whether that's housing support or addressing food insecurity or transportation. Our social service team, our community health workers, our health promotion specialists, they also are key members of the team, helping people be able to engage in their own health. I'm sure I'm missing some departments as I think about our pharmacists and our clinical pharmacists. When people come in with their handful of meds and what do I do? Our clinical pharmacists help them walk through that story. It's an organization which what we're striving for is compassionate care for all. And so where others may seek to push people to the margins because of their diagnosis or their race and ethnicity or their language or their housing status, we center folks that others would put on the margins and strive to give them excellent care.
Thank you so much. Maybe if you could just tell, I was thinking as you were sharing, one story or one memory that really impacted you and really kind of cemented your calling to be in this position that you'd like to just share briefly with us.
One thing that cemented
yeah, some story or moment or memory that really of a patient or a situation where you really felt like you and the agency made a difference and kind of getting outside the box here a little bit, I know. But
yeah, no, that's okay. So there are so many stories that are like this. So 2 come to mind. Just yesterday, I still see patients in the agency. I am the CEO and president, but I also see patients in the agency. And yesterday, a patient of mine dropped off some paperwork for me to fill out. And so I gave him a call and said, hey, I'm filling out your paperwork. Just want to make sure you didn't have any questions. And he said, hey, doc, I went to the pharmacy to get my medication and my insurance had changed. And so I thought I was going to have to go to another institution. And when I went to that other institution, I found out that all of a sudden I was going to have to pay just a percentage of the prescription cost, but that would be tens of thousands of dollars over the course of the year.
Wow.
So I came back and I talked with your team over at Avenue 360. I talked with the pharmacy director. I talked with the social services folks. And they told me that because of my diagnosis and because of different resources and programs that the agency provides, that for the gap between what my insurance covers and what my other needs are, that they would be able to help facilitate much of that gap being closed. And they helped me access some programs that I'm eligible for that I didn't know I was eligible for that would help cover that gap in coverage. And he said, I'm so glad that you called because I wanted to thank you for that, because I was scared that I've had my HIV under such good control for so many years, and all of a sudden it was going to fall out of control because I couldn't access medication. And when I went to the other spaces and other organizations, they didn't even tell me these resources were available to me. So that's a hot off the press discussion that I had just yesterday. But some of the other stories that I think about are folks who engage with the agency in various areas and in various departments within the agency. And there's one young man who had been diagnosed also with HIV and had not been able to engage with medication properly and ended up with AIDS. And so he was so profoundly ill that he was on his deathbed, and an external organization called us and said, so-and-so is dying and they need a place to go. And so we brought him into Omega House, our AIDS hospice, and they cared for him. And he ended up starting to take his meds reliably and to have access to a well-rounded diet and to spend time with the chaplain just talking about his life and his desire to live. And we ended up having a person graduate from hospice. How often can you say that? So this young man ended up, so the fact we were like, well, you can't stay at hospice forever. You've gained weight, you're taking your meds, your HIV is much better controlled. Let's get you, fully engaged with your primary care provider. And we were also able to link him with housing support.
Wow.
And
That's
so
awesome.
I think one of the things he's most happy about is that he went to the dental team and they hooked him up with dentures and he has a smile back. And when you
Wow.
talk to him, he says, I don't know if I'm more happy that I can smile or that I'm alive with him housing. He is overflowing with joy and with gratefulness. And we are grateful. We are grateful to have the opportunity to partner with someone to literally have them look into the grave and say, not today. Right,
Wow.
with someone. So it's really just an honor and privilege to do the work. And there's so many amazing stories of people who we've had the opportunity to walk alongside and really transform their lives. I could really go on. There's so many stories. Some stories of people I visited with the recovery support team and was able to sit in on one of their groups. And there was a young lady there who, as open-minded as I am, she is someone that I would not have engaged with if I encountered her out in the world. And she told the team that what she shared at the group was that she had allowed her life to get to the point where she had become the invisible, but through the support of the recovery support peer recovery specialist and the group therapy, and the supportive outpatient program, she was now enrolled to get her GED. She had applied for a job and she was like 75 days clean,
Wow.
right? And so she said that, and it really touched my heart. And it also, I was convicted by her statement when she said, I went from being invisible to being seen and being able to be seen. And I thought, gosh, I do this work every day. And I have to be honest with myself that even for me, she may have been someone that I would say, oh gosh, right? And
Hmm.
but the team doesn't give up on anyone.
Right. That's
They
awesome.
literally will go out under the bridges and talk with people and talk with them until they're ready to say,
Mhm.
I'm ready to give this another go and get off this spot out from under this bridge and try to have a productive life that's housed. So, I mean, the work is amazing and the stories are
Yeah.
innumerable. I know we have limited time, but there's just the stories are amazing.
Yeah. I love your passion. I wish we had more time, but so for the last few minutes, if you could just share a little bit about how being a part of Vistage has helped you in your current role.
Awesome. So I've been a Vistage member for over a year now, and Mickey has been my Vistage coach. I will say that Vistage has been amazing for me. I'm a first-time CEO. I've been doing this since 2020, but I'm a doctor, I'm a scientist, I'm lots of things, but I'd never been a CEO. And having this circle of other executives from different walks of life who aren't in competition with you, who are in a space where they can share what's going on in their organizations, where they can give you feedback about what's going on in your organization, and they can hold you accountable to the things that you say you want to do and the person that you say you want to be, has been invaluable. As a healthcare organization going through COVID, we encountered the financial challenges that so many organizations in healthcare during COVID went through. And I would say that my Vistage peer group was invaluable in helping me make some hard decisions
Mhm.
related to the structure of the organization, the personnel, and the ways that we thought about engaging to help get us through those moments. And so I and the 13,000 patients that we serve are forever indebted to that good hard work. We spent a whole day together. There's learning, there's access to resources and to expertise that I wouldn't otherwise have access to. But then probably as important is the real talk, being held accountable by your colleagues, peers. And now I will say I can call them my friends,
Mhm.
who will say, hey, Flash, you said you were going to do X and you did Y. Let's talk about what was that all about? Why didn't you do
Mhm.
X? And you hem and you haw, and you're like, guys, you're right. I kind of did just next to what I committed to do. I'm going to go back. I'm going to make it right. And I'm going to report back next month.
Mhm.
And you have your wins, you have your losses, but the team is there to cheer you along every step of the way and hold you accountable. It's invaluable.
Thank you. Thank you so much. Appreciate you sharing that. And last but not least, just let's say the most impactful takeaway or action item that you've seen this year that's helped you in Evident 360 the most.
I think the thing that's helped the most is um, support for key personnel change. You
Mhm.
know, um, as a people person and a clinician, that's always going to be the hardest thing for me because I'm people first. Organizations and activities come and go, but people are where my priority is. And so, really having the accountability partners to make sure that when it's not working out, that you make those decisions with the appropriate speed. I think one of the learnings that we had in a Vistas group was hire slow, fire fast,
Mhm.
that you
Got it.
wait until desperate moments, and then you just hire somebody because you need them. And then you try to work with them forever and ever in a day, and it's undermining the culture of the organization. And so those are some of the most impactful decisions that the Vistage group helped me process through. I still have to be the one to do the real work and to make it happen, but having that team to help you process through, especially at an executive level, you can't talk about some of these things within the agency and with your team, even with your HR director sometimes, right? And so having those external confidants was really valuable. And those changes have been transformative for the organization and for me as a
Awesome.
leader.
Mm. Thank you so much, Dr. Flash. Appreciate you taking the time out of your busy day. And yeah, we will see you in a couple of weeks at the Vistage meeting.
Absolutely. It was my pleasure. Thank you, Mickey.
You're welcome.